welcome to another episode of We Are Next. I am your host, Kevan Peters, and I am proud to bring you a special episode this week in recognition of Mental Health Week here in Canada. In this episode, we are joined by Christopher Yendt, President of the Canadian Mental Health Association, Niagara Branch. I truly admire Chris's strength and how he so openly shared with me a small part of his journey leading toward an active role with the Canadian Mental Health Association. Chris, you are an inspiration, and I truly appreciate you and what you're doing for our community.
I'd like to talk a bit about your experience with Mental Health Association. Could you talk a bit about your position and your experience and CMH as an association?
Sure, I can. So I first got involved with the Canadian Mental Health Association, the Niagara branch, back in 2014. I applied to serve on their board of directors. Was unsuccessful in my application, but they invited me to join one of their committees, the bylaw committee, which, if anyone knows me, is an absolute passion for me. And so I was all too eager to take up the opportunity, and didn't think much more of it until later that year. I went through a particularly strenuous time. I developed a number of symptoms which have since been diagnosed and, really burgeoned into a full board mental health crisis, which saw me spend some time in the hospital, spend some time in the Safe Beds program that CMHA provides, which I didn't even know was run by CMHA at the time I was in crisis. I was just glad that this program was available to me. And a number of different ups and downs and roads, lost my license as a result of my visit in the hospital as well, and was particularly suicidal throughout that period. Again, still had no formalized diagnosis as of yet, and still had no medication to help support my diagnosis. And I remember one particularly bad day where I walked out and intended to take my own life by jumping from a bridge. And before I did jump, I stood on the barrier before I jumped below, and something compelled me not to. And so I said, "Oh, okay." I stepped back and walked back to the apartment I was staying in at the time, and I checked my email, and I had received an email from the Canadian Mental Health Association inviting me to join their board because there'd been a vacancy on their board, and they were happy to have me aboard. And I joke many times now with the executive director about how CMHA literally saved my life, and I don't think anybody intends, from a programmatic standpoint, when we look at the kind of offerings that CMHA does for the people within our community, that a board position would be the one that would help save or support someone. But that was the thing for me, and it gave me hope and a way to give back to individuals in the community again and share my own experiences with others who might be in a similar or at least same enough boat to understand what they're going through. And so that was in March of 2015 that I joined the board, and now I'm the chair of the board president, and it's been quite a remarkable journey. We've gotten to see a number of major changes for the organization. The most recent was the move from our previous Page Street location and our previous Wellington Street location in downtown St. Catharines into a new combined space on Welland Avenue, Welland and Tasker, which is also co-located with the Niagara Health System. And so we have a number of different programs running side by side, a new Safe Beds location within that space, providing more people more access than we ever did before. And it was quite invigorating to get to stand there. I guess it's a year now since we cut the ribbon and opened the doors, and having been a client of the former Safe Beds, to get to see and tour this new space and know that something much better now is available for the people in our community that need it than was before. And CMHA has opened up a number of other avenues as well. So I speak quite regularly, either to Niagara College classes on my experiences and around what it's like to live with a disorder like mine, and some of the difficulties that go along with it, as well as I participate in the crisis intervention training for Niagara Police, making sure that our police are as informed as possible about the potential impacts of engaging with individuals who are in really marginalized or rough spaces around their mental health, and making sure that they're doing so in a way that exhibits care and concern for those individuals and not just the enforcement of rules and things like that. So all that is to say, I couldn't say enough great things about the work that CMHA does. We are the largest provider of mental health and addiction service for adults within the Niagara region. And we have sites across the region as well. So we have a main site in St. Catharines, but we also have sites in Niagara Falls and Fort Erie, and then do other partnership with other agencies in other municipalities around the region based on need. So
thank you for your transparent story. I appreciate that honesty, and you definitely have a level of introspection where you're able to reflect on that time and be able to talk about it as an optimistic response. So I do really appreciate that. As we enter this week is just happens to be Canadian Mental Health Week. Is there any specific programming we can expect to see from the Niagara branch?
Just this week, I mean, again, I would stress, don't confine it to a week, right? Don't let just the mental health weeks be the weeks that you're willing to talk to people about the things that you're going through. Talk to people about the things you're going through all the time. Note our services continue to be available, right? Particularly our crisis lines in Coast, to make sure that you are talking to individuals if you do need support, but break those things down. And I can't tell you enough how much better it feels to be in a space that's open and not having that hidden inside of you. Yeah, it's tough at the beginning and it sucks and it's very uncomfortable. But if you do the work, the investment pays off.
We hear a lot the phrase of changing the conversation and eliminating the stigma. You noted about how your family had gone through a bit of an evolution, but have you seen anything on the greater scale in the media, in the greater public? Has there been any progress?
There are discernible benefits or positives that we're seeing now in society move forward slowly but surely on specific topics. It's not as fast as we would want. It's not as fulsome as we would want, right? I mean, I'll note, I've said this to you before, but one of my biggest pet peeves is when people say committed suicide, right? And that for a host of reasons, we don't use that language anymore. We use die by suicide, completed suicide. There's a number of other things to take away there, mostly because of where the term committed comes from. It comes from both a sense of committing an individual to an institution as a result of particular action. It implies a sense of finality. It also implies a sin, right? Is it committing a sin? Is it committing that action? And all of those things are no longer true. And so by changing the language around topics such as this, but in any number of different things in mental health, we see agency be returned to individuals as opposed to being taken collectively by society. Other notable examples are when people say, well, something gives me such bad anxiety. No, it doesn't. It makes you anxious. Anxiety is a diagnosable condition only done under specific parameters by a specific individual with training to do so, right? Oh, I feel really depressed. No, you don't. You feel sad. Right? Depression is, again, something that is diagnosed. And then we got to be careful as well with those terms that we don't apply them to things that are inanimate that couldn't possibly feel those things, right? So how often have you heard someone say, the weather's so depressing today? The weather isn't depressing, actually. The weather cannot exhibit complex emotions and doesn't have a diagnosis as provided by a psychiatrist. So no, the weather is lousy. The weather is crappy. But these are the sorts of things that, as we look to start breaking away stigma, oppression, marginalization, whatever you want to call it, language is going to be truly front and center in making that wall come down. And I think we're getting there. I think we're starting to see those pieces. I mean, news media, these sorts of things haven't necessarily completely followed suit. So if you read newspaper articles or those sorts of things, haven't completely followed suit yet, but you do see some of this language, at least in my networks, online in spaces like your Twitters, Instagrams, and Facebook, starting to change that level of conversation around language. And again, it's not going to be tomorrow that everybody starts doing it. And even occasionally, I catch myself getting real close to using language I shouldn't. But when I compare that to, the way I remember the world prior to coming to university and then even starting university, there were no conversations anywhere about any of this sort of thing about language. And I think part of that is due to the fact that I'm now involved in different circles, which would hear these things first, as opposed to when I started my undergrad. But I also believe it is because society is ever so slowly moving forward into a place that embraces mental health is as serious as physical health. It is just as big a deal.
I appreciate giving those specific examples about language, because we hear about changing the conversation, but when you don't know how, you don't know where to change your conversation. You don't know how to adjust your language moving forward. So I appreciate those specific examples, and it's definitely something I'd like to see more of and hear more of it, is to more than just good intentions, like actual training on how to communicate appropriately.
To exactly your point, I think there needs to be a willingness of everyone to start to evaluate language. One would argue, depending on your field of study, is among the most powerful elements of the human experience. It really differentiates us from other animalia in the complexity of our ability to convey information to one another. So not that other animals within the kingdom do have their own ability to communicate, because they do, but the depth of our communication, because of the volume of words and the infliction that we can place in words, is massive. And so it behooves us to consider how those impacts can be felt by all communities, not just those that did the initial conceptualization or coding of language in the first place.
Thank you again to Christopher Yendt for sharing his story with us. We'll post the rest of our conversation next week, but felt that this topic deserved a dedicated episode. A final note to everybody watching. Please consider this video a reminder to have the courage to stand by your friends in their time of need. You don't need to understand. You don't need to have all the solutions. Simply being there makes all the difference. Also, be brave enough to receive their support in return. Remember, you are not alone, and you are amazing. Thank you.